So next we have Dr. Rebeccah Shalev.
Okay. Let's see. Okay. Can y'all see my slides?
No.
No? Oh no. Okay. Let's try it again. Share screen. Let's try that. There we go. Can y'all see that?
Yes.
Yes, you can see the slide?
Yes. Mm-hmm.
Okay. All right. Woohoo. We did it. Okay. All right. I am Dr. Rebeccah Shalev. I am a naturopathic doctor. I see patients at Labrador's Healthcare Circle in Oakland, as well as at Comprehensive Wellness in Walnut Creek, and virtually through phone and Zoom appointments, pretty much anywhere. A lot of people have not heard of naturopathic medicine, so I'll just give you a quick overview of what it is. Naturopathic medicine is where conventional medicine and holistic medicine intersect. Many people have heard the term functional medicine. It's got more name recognition than naturopathic medicine, but it grew out of naturopathic medicine and is actually kind of a subset of what we as naturopaths do. So as an ND, I work with everything from drugs to herbs to homeopathy to energetic medicine, and I can do primary care as well as specialty treatments. My practice focuses a lot on, I do a lot of hormones, so that's menopause, testosterone deficiency, hypothyroidism, diabetes, and insulin resistance. Big parts of my practice, but I look at everything holistically, so nothing's in isolation. It's all part of the whole picture. I do treat a lot of chronic infections as well, and one part of that is chronic fatigue. Which very frequently has a viral cause. So I have been working with viruses in many patients for some time now, and I'm going to be drawing on that experience today as I talk to you. So how do I go to the next slide? There it is. Awesome. This is my disclaimer, which is basically that I am not officially giving you medical advice. Please see your doctor if you need that. The virus that causes COVID-19 is a new virus. The virus and the disease are both new, and we are learning as we go. Every day, some new story comes out about a medication that works, and then the next day we're told it doesn't work, because we're all learning as we go. Everyone is encouraged to keep that in mind and follow CDC guidelines out there to keep yourself as healthy as possible. With that said, the novel coronavirus is novel. However, other coronaviruses have been around for years and years and years, and in fact cause the common cold. Naturopathic medicine has got quite a good track record in treating other viruses, including many in the coronavirus family, and I do as well personally. So I'm going to be drawing from that experience, but just keep that in mind that everything we know about the current pandemic is rapidly evolving. Just to give you a quick oversimplified summary of how the immune system works, and I'm going to try to take a full semester of immunology from med school and distill it down to about a minute, and see see if I can make it all make sense. So the first function of the immune system is to stop pathogens from getting into our bodies. We do that by setting up barriers, our skin, our mucous membranes, and the mucus we produce. That mucus is in the nose, it's in the lungs. It helps us to cough out pathogens that we have inhaled. Masks and gloves are not really part of their immune system, but they are also working as barriers in the current pandemic. We've all gotten quite used to using them. Hand sanitizer and hand washing are serving to remove germs that we've come in contact with. Laura just talked a little bit about hand sanitizer. I'm also not very fond of it for a couple of reasons. One, our skin naturally produces oils that have antimicrobial functions to them. And when we are stripping those oils off our skin, in particular with alcohol-based hand sanitizers, we're actually removing some of the protective ability of our immune system. A couple other reasons I'm not so fond of hand sanitizers is they tend to be very chemical based, and those chemicals can be hazardous to your health, as well as there's the possibility that they may breed superbugs by killing off the weak microbes. I'm concerned that we're going to start to see more and more antimicrobial resistance down the road a year or two from now. Hand washing is great. We've been using it forever. It works rather than by killing germs as much as the way a hand sanitizer does. It actually removes the germs. So it doesn't carry that risk of resistance and creation of superbugs. People always ask, well, what can you do when you're out in the world and you don't have access to wash your hands? Disposable gloves can be great if you're concerned about touching contaminated surfaces. If you have multiple pairs and can change them frequently, obviously that is ideal. However, what we are seeing more and more with the current pandemic is that it's really spread through respiratory droplets. So inhalation is more of a hazard, and masks are going to really do more to protect us rather than avoiding touching surfaces that have them, unless of course you touch a contaminated surface and immediately rub your eyes, which we've all learned not to do. Okay, after that, when the bugs get in, the killer cells and the memory cells go to work. Our killer cells are things like natural killer cells, phagocytes. There's a whole bunch of immune cells. They live in our body. They literally go in and eat the pathogens that get in. And their goal is to kill the pathogens before the pathogens can multiply out of control and become a more severe infection. The other thing that is happening at the same time is your immune system is forming memory of what it has come in contact with. These are our antibodies, and they are basically a way of their cells that the immune system creates to help the immune system as a whole recognize when there's an infection. Because the quicker that we recognize that foreign invaders have gotten in, the quicker we can start mounting more killer cells, and it's easier to kill off the infection before it multiplies. So having antibodies is helpful because it allows us to mount a faster response before infections get worse. Okay. Hang on a second. Something just already happened. Okay, testing options that are currently available right now with the current pandemic, the nasal swab and the antibodies tests. The nasal swab was the first test that kind of hit the market, as we'd call it. And it tests for an acute infection. These are the free tests that are out there. If you go to your CVS and you get a free COVID test, this is going to check for a current active infection. And basically what they're going to do is hand you a very long Q-tip to stick up your nose, back into your sinuses, take a sample of that mucus. And what they're looking for are viral DNA particles. That's going to show us the presence of the coronavirus in your nasal passages. This test is the most useful for an acute infection. It has, however, a really high rate of false negatives, meaning that if it comes back positive, you've definitely been exposed. If it comes back negative, there's a 30% chance that they just didn't find it and you actually do still have the infection. The antibodies test is a newer test. More and more are becoming available now. And it is a blood test. There are some that are done with a blood draw in a lab, others that are done at home with a finger prick. These tests have all been hitting the market very quickly, and some seem to be more effective than others. But what the antibodies tests do is they show that you have been exposed and that your immune system has built those antibodies to remember the exposure to this virus. There are different types of antibodies, some that show more recent exposure, some that show later exposure. My personal favorites right now that are available are the one through LabCorp, as well as one that Vibrant Wellness is doing. The LabCorp test is covered by insurance. Most people's insurance actually pay 100% of the fees for this test. The LabCorp one I like a lot because it tests multiple antibodies. So depending on when you were infected, it's more likely to pick that one up. And next slide. Okay. This is sort of an informal list of stages that we see with the coronavirus infection. The first stage is infection, which is what I just talked about. The virus gets into your body. Usually it's through inhalation, and then it starts to replicate. This is where, at this place, right after infection and replication, is when we're going to have most success in terms of fighting it. Again, the earlier we start attacking the virus, the quicker we're going to knock it down. Inflammation, hypercoagulation, hospitalization are later stages in this illness, and our number one goal is to keep everybody out of the hospital. It's the late stages of inflammation and hypercoagulation that tend to lead to hospitalization. So what am I talking about here? Inflammation is kind of the first thing that we all really heard about with the lung symptoms that people are having. And that's what tends to put people onto a ventilator. So when the infection starts accelerating, we see lung inflammation, we see inflammation in other parts of the body. In kids, that's kind of the big symptom that we've been seeing a lot with this Kawasaki disease type presentation, which is basically a systemic inflammatory response. Hypercoagulation basically means your blood is sticky and clotty. So it's prone to forming clots, it coagulates, it sticks together. There's one of the theories right now that's behind a lot of the lung problems we're seeing is actually that it's caused by clotting. And so anything we can do to help, keep the blood flowing smoothly is going to help to reduce the chance of that. Hospitalization is late stage. That's all the talk about ventilators that we've heard about. And obviously the goal is to not get to that place. Okay, so are there any questions so far? I don't know how to show that.
There's a question. What was the name of the second company for antibodies after LabCorp?
LabCorp, and there's a Vibrant, it's got two names, Vibrant America, Vibrant Wellness, it's the same lab. The Vibrant test is excellent. It's very thorough, it tests more antibodies. Insurance doesn't cover it, but I think it's about $120 cash price. The LabCorp test is about the same price if you're paying cash, but insurance, usually any insurance will cover it 100% with a doctor's order. So that's a pretty good deal. Yeah, and the Vibrant one, I'm not sure if it requires a doctor's order or not. So that's it. All right, should I keep going?
Yes, please.
Okay, I'm going to get into different nutrients that will help us respond to acute viral infections. Now, Laura touched on a number of these nutrients. I'm going to build on what she talked about. The ranges that I'm going to give, the low end is more of a preventative dose to support your immune system right now so that you don't get sick. The higher end of the range is if you start getting sick, that's what you want to be looking at. So now these ranges are pretty generic for any viral infection. So if you get a cold or a flu, you can use these ranges that I'm giving you here as a way to start attacking it. And this is exactly what I do when I get sick. These are the nutrients that I have in my home first aid kit for any virus. These are the first things that I turn to. And usually the length of time that you'd be taking the high end of the dose is pretty much while you're having symptoms. Typically, if you hit an illness quickly, once you first start having symptoms, most of us are able to really knock it down within a few days. It's going to depend on your immune health and your other factors. But while you're having acute symptoms, that's when you'd want to be taking the high end of the range that I'm going to be giving here. And that's going to apply to pretty much all the supplements. So zinc, first of all, I know Laura talked about this one. Zinc is fabulous for our immune system. It can upset the stomach. Taking it with a meal can definitely help. 50 milligrams 2 to 3 times per day is a high dose of zinc. It's definitely higher than, again, what you'd be taking for maintenance. For example, I take right now 25 milligrams once a day just to kind of build up my own levels. And then again, if I start getting sick, I'm going to move up towards that higher range for a few days. Vitamin D is super important for immune response. That 10,000 I use a day is a pretty good pretty strong dose. That I would say is a normal kind of wintertime dose when you're at increased risk of getting illness, or if you've got autoimmune conditions, because vitamin D helps to modulate the immune system. If you're pretty healthy, not facing any exposures, you can really usually get by with maybe 2,000 IUs a day pretty commonly. When we go into the high doses of vitamin D, and that's that 50,000 IUs that you see there, it actually starts to have a direct antiviral effect. So this is not something that you're going to take every day, but again, if you get sick for about 3 days, 50,000 IUs, that can be a really good tool. Vitamin C, and Laura talked about this one as well, vitamin C is absolutely kind of one of our go-tos right now in this time. A normal dose of 1,000 to 2,000 milligrams per day would be for an otherwise healthy person wanting to build up a baseline level to support your immune system at this point in time. And I see a lot of people writing notes. If you put your email in the chat box, I will email out the slides afterwards, so you can definitely have access to them, or shoot me an email if you want to get them. It's the other thing. I'm happy to share the slides at the end so that you don't have to write it all down because I know there's a lot of numbers here. So with vitamin C, we always dose this to bowel tolerance. I don't know did you talk about that, Laura? No, okay. So the body has this really kind of cool mechanism with vitamin C. Once it has enough, it gets rid of it. And the way it gets rid of it is by giving you diarrhea. So, I mean, not that having diarrhea is cool, but that it's a really kind of instant feedback. So in normal times, if you're deficient in vitamin C, your body's going to be able to absorb more. You're going to be able to take a higher level before you actually hit that place of bowel tolerance, which is you get diarrhea. So what I usually tell people is start low, work your way up, get to that place of loose stools, and then back off just a little bit, and that's kind of your dose. It's going to be different for everybody. As you start repleting deficiencies, that dose is going to drop, and you're going to need less, and your bowel tolerance is going to drop. When we get sick, our bowel tolerance increases dramatically, sometimes up to 10 times our everyday bowel tolerance. So in an acute situation, if you're having any symptoms, and again, this is common colds and flus, this is coronavirus, this is really any type of sicky under the weather type thing, you're going to be able to take a higher dose of vitamin C before you hit that bowel tolerance. Again, that rule of thumb is often up to 10 times what I've got here, which is the maintenance dose. There is no real toxic level of vitamin C, so you don't have to worry about overdosing on it. The body will get rid of the excess. When we do vitamin C IVs on people for things like cancer treatment, we often go up to 100 to 125,000 milligrams. That's like literally 100 times what I've got here. When it's delivered IV, you're able to handle a lot more because it doesn't go through the gut, so you can absorb a whole lot more before hitting that place of bowel tolerance. So yeah, that's kind of the point, that there's really no toxic level, so you don't need to worry about that with vitamin C. Oh, and then what I was going to add, I'll talk about that some more. Okay, zinc ionophores. Now, ionophores are it's a big word. Zinc to go to work as an immune supplement. We just talked about that on the last slide. It is super duper for the immune system. It's also great for a lot of other things. It's used a lot in men's health conditions as well, but definitely it's a good immune supplement. For it to work, it has to be able to get into our cells. What it needs is essentially a carrier called an ionophore, which carries it into our cells so that it can go to work. If it doesn't get in, it can't do its job, and you're wasting your zinc and giving yourself an upset stomach for nothing. Hydroxychloroquine, which I'm sure we've all heard of now, thank you to our president, is a drug that showed some promise for some period of time, and it is believed that the reason why it was helpful with the current pandemic is because it is a zinc ionophore. Okay, a lot of people want to know, why would an anti-malaria drug be effective against the virus? It's not because it's necessarily directly killing the virus, but because it's helping that zinc to get into the cell. And Laura talked about how with this particular disease, one of the hallmark symptoms is that loss of taste and smell, which is something that we have associated with zinc deficiency for quite some time. So it does seem that that zinc is really a big player here. The cool thing is that we have other natural nutrients that are also zinc ionophores without the dangers of hydroxychloroquine. Hydroxychloroquine can cause potentially fatal heart rhythms. It's also quite toxic, hard to get. You know, there's a shortage worldwide now because of, you know, the president talking about it. There's a lot of reasons to look for alternatives. Quercetin, EGCG, and molybdenum are all natural zinc ionophores. Quercetin, and I'm going to talk about that in a minute as well, is really kind of a cool tool in this pandemic because it serves dual purposes. It's both anti-inflammatory and it's a zinc ionophore. It's also, I have a few bottles of it in my home first aid kit. I figure if I never come down with the virus and I don't need it, I'll just use it for allergies. It's also just great for everyday seasonal or food, any type of allergies, because it's so anti-inflammatory. So it's a useful thing to have in your first aid kit. If you don't use it now, you'll use it at some point. EGCG is an extract from tea, and it also works as a zinc ionophore. Molybdenum is a mineral, and it also functions as a zinc ionophore. I've got the dosages listed here. 75 to 500 micrograms per day would be sort of in an acute situation. If it were me, you know, and I were really sick and I was wanting to get the zinc into the cells, I would use whatever supplements I could get my hands on right now, or all of the above. And that is actually another good point I want to make about supplements right now. When you're getting things in a bottle versus food, and Laura talked a lot about the benefits of food, the benefits of actually using supplements that you may be buying commercially is that you can get higher doses. So in an acute situation, when you want to get to that high end of the range I'm putting, and you need to get there fast, you're often going to need to have a supplement in a bottle versus from food. It's tough to get the really high doses with food. Many of these, there are shortages right now of many of the supplements I'm talking about because a lot of people have been stocking up on them, you know, next to the closet full of toilet paper. So I personally, you know, have tried to, you know, have a few bottles of just about whatever I can at home in my little first aid kit, because it can be hard to get some of these things when you need them, and it can vary from time to time. Yeah. Any questions so far? Any others, Laura?
No, just I think you've addressed that.
Okay. One other point. Okay, wait. So that was all right. So that was zinc ionophores, yeah. And that little link on the bottom is a study that looks at quercetin and EGCG and does give some doses. So. Okay, antiviral supplements. Vitamin C is absolutely one of our workhorses right now. If you can get liposomal C, it's really cool. Liposomal preparations, I'm going to talk about that in terms of both vitamin C and melatonin later on. When a nutrient is prepared in a liposomal fashion, it's basically bonded to a fat molecule. What that allows is that it can absorb directly through our mucous membranes and go to work. So if you take a liposomal C and you hold it under your tongue for 30 seconds to a minute, that is going to absorb sublingually, go directly into the bloodstream. It's a little bit, I think it's kind of the next best thing to getting an IV. What the neat thing about that is that when it goes directly into the bloodstream, you can take a much higher dose without hitting the bowel tolerance that you're going to get with oral C. So, for example, what I do for general prevention is I have just a regular bottle of cheap vitamin C, where I take 1,000 to 2,000 milligrams a day, every day, just to stay healthy. I've got a bottle of liposomal C as well that I have put away in case I get sick, or if I have had like an exposure to someone that I think might be sick and I want to really rev up my immune system for a few days. And with the liposomal C, you can do a much higher dose for a few days. I find, for example, I tolerate about 1,000 of the normal oral C, but with liposomal, I can easily go up to 10,000 without hitting that bowel tolerance. So it's really, it's much better absorbed. The the Chinese studies that looked at IV vitamin C against coronavirus infections were actually using doses that we can obtain pretty easily with liposomal C. So a lot of people have asked me about if they can get IV vitamin C, and the answer is some doctors are providing it. We don't have IVs at Labras, but you can really get those doses with liposomal C. The ones they were using in China were only about 10,000 milligrams a day. And so that's quite doable at home. So that's a really good one to get your hands on. Vitamin A as well, in high doses, is a very powerful antiviral. 25,000 milligrams per day is a pretty good baseline dose, for this time of increased immune need. If you, again, in an acute situation, you're sick, you're exposed to somebody, I like to go up to about 100,000 milligrams per day for 3 to 4 days. Okay, many people are concerned about possible toxicity with vitamin A. Vitamin A is really only toxic to a developing fetus. So if there's any chance that you could be pregnant, you are not going to want to take the doses that I've just listed here. Really use the other supplements that we're talking about. If there's no chance of pregnancy, there's really not any risk of toxicity over a few days. It has a cumulative effect. And so for 3 or 4 days of those high doses, there shouldn't be any problem. Vitamin D, I talked about before, in those super high doses, that has a direct antiviral effect. Vitamin D, it's definitely good to take it with fats. Same with vitamin A. Oregano oil is one of my favorite herbs. It pretty much kills everything. It's a broad spectrum antimicrobial. So if you've got bacterial, fungal, viral infection, any of these, oregano oil is likely going to be effective against it. Because it's such a broad spectrum antimicrobial, it can have some of the side effects of taking an antibiotic, where many of us are familiar with. You take an antibiotic, you kill off your healthy gut flora, and you can end up getting an imbalance. So if you're taking oregano oil, I really recommend taking some good, strong probiotics as well to help rebuild any kind of intestinal flora that gets caught in the crossfire. Best way to do that is to separate them different times of the day. Take the oregano oil, maybe morning and breakfast and lunch, and then take your probiotics before bed. So that by then the oregano oil has made it through your digestive tract and won't kill off the probiotics you just swallowed. And the probiotics will have all night to multiply in your gut before getting hit with more oregano oil the next day. Some other antivirals, selenium, melatonin, the herb skullcap. And again, I've given you a number of antiviral supplements. They may not all be available. Honestly, they're all good. Whatever you can get your hands on is really the best. The one that's available is the best one for you. Melatonin, normally when people take it for sleep, you take it 1 to 3 milligrams at bedtime. When you take it in that liposomal form that I talked about, like the same thing with vitamin C, in a liposomal form, you can get a really high dose, up to 25 milligrams per day, which is it's a much higher than what we would normally take it for bed. It doesn't make you any sleepier than 3 milligrams does. But what it does in these high doses is it actually really starts to work as an antiviral. It's also a great detoxifier for the brain. So it's a really nice tool for brain inflammations and neurological issues. Let's see. Okay, anti-inflammatories. So here's another drug that was there something?
We have a few more minutes.
What's that?
You only have a few more minutes.
I'm watching the time, thanks. I know, trying to get through. We're getting there, we're almost done. Dexamethasone has been in the news a lot lately. It is a steroid medication. One of the late stage symptoms that we see with the coronavirus is inflammation. I think I don't know that it's any better than any other steroid, but basically it's working by suppressing that inflammation. We've got a couple of natural alternatives to that, curcumin and quercetin. Curcumin is an extract of turmeric. Just taking that orange spice is not as effective. It's not as absorbable. It's really nice to get the curcumin isolate when you need to get the high doses that we talked about here. Quercetin I talked about earlier. It's this kind of dual duty thing. It works on lung inflammation. It also is a zinc ionophore, so it's a really useful thing to have in your first aid kit right now. Lung support, I just talked about question again. That one keeps coming up. NAC is N-acetylcysteine. That is a mucolytic. What it does is it helps to break up mucus. So if in the case that somebody's having, kind of late stage lung problems, ventilator type situation, NAC can be a really good tool because it helps to break up that mucus to get that oxygen into the respiratory tract. Anticoagulants, I did talk about that a little bit earlier, the danger of blood clotting. Curcumin, again, is an anticoagulant, so it's another kind of dual duty herb. One of the things, if you're taking it on a normal basis as an anti-inflammatory, it's kind of good to get an idea. Your dosage is going to vary based on which preparation. There's a number of different formulas that are more absorbable than others. I would recommend starting low. If you start to see that, hey, you cut or scratch yourself and you're starting to bleed a lot more, then that's too high a dose for you. But it's kind of nice to know what that dose is in case you ever need it for an anticoagulant purpose. Proteolytic enzymes help to break down inflammation. Those I'd recommend consulting with one of us before dosing. If you have any existing clots, if you're anybody who's been on blood thinners, you want to be a little more careful with the proteolytic enzymes. Also, if you have like a stomach ulcers, those can be really hard on that. So they're a little riskier. I would actually talk to somebody before taking those, but they can help as well to break down the clots in blood. And that's it, I think. So are there more questions, Laura? Let's see if
I don't think so.
Stop the screen. Oh. Okay.
So.
Let's check. Oh, there's a bunch of people in the chat.
Yep, there's been a lot of chat.
Okay, so we've got oregano leaves. Can fresh oregano leaves from the garden be a benefit? Great for Italian cooking. Definitely not going to get yes, somewhat, but you're not going to be able to get the high doses that you would need in an acute situation. Oh, this is a really important point. Doreen asks that she's heard there's a lot of counterfeit supplements on Amazon. Where do you recommend going to purchase supplements we can trust? This is a big deal, Doreen. Thank you for bringing it up. Yes, there are a lot of counterfeit supplements out there on Amazon. I do not like sending people to Amazon to purchase supplements. I use an online dispensary called FullScript that distributes high-grade professional quality supplements. It's what I use in my practice. Most of my patients, if not all, are signed up. It's a free site where basically they distribute professional grade supplements through doctor to patients. Everything is very quality controlled. So I really like that I can trust anything that they carry. Also, it allows me to recommend supplements to people, to send them dosage recommendations, and to discount the retail price as well, which is a really nice option. So it's technically patients are supposed to sign up through a doctor. If anybody on here today is not an existing patient of mine and you want to sign up for it, shoot me an email, I'll add you in. I'm happy to do that. It's a great way to get any sort of supplements, again, for high quality, good price, and something that you can trust.
I also use FullScript, Rebecca.
Perfect. So then, yeah, if people are applying for Laura, then you could talk to her about that as well.
Joan also uses FullScript. It's a good.
Oh, I didn't know you were using them now, Joan, too. Yeah. So all right, great. So all of us. And that's a really good way of doing that.
I think we covered all the other questions throughout.
Yeah, I'm just flipping through these. What do you look for when buying zinc? Most of the zincs work. I like zinc. I think zinc picolinate is a pretty good absorption. Laura, I don't know if you have a favorite form of zinc.
I answered also.
What's that?
What I said also in the chat.
You said that too? Okay. And what else?
Also, I want to mention that unrefined cod liver oil can give you a lot of those vitamin A, D, and K2 all in balance. So there's less chance of toxicity or overabundance when and it doesn't, you can take capsules of unrefined cod liver oil so you don't have to taste it. So a lot of people have that issue. But cod livers actually are very tasty and I'm surprisingly tasty. And I've noticed that when I feel like I need some extra fat soluble vitamins, those cod livers taste really good. And when I don't, they're okay.
Mm-hmm.
So canned cod livers from Norway.
Yeah.
Quite good.
Yeah.
So
It's an important point, Laura, that our bodies have sort of an innate wisdom, and that when healthy foods taste good, that's a good sign that our body wants them. And when they stop tasting good, usually it means you've kind of had enough. So if a supplement starts to smell really bad, I generally don't take it.
yeah.